Welcome to 24 Cares. I'm Devin Owens-Teller, leader of operations and analytics.
And I'm Annalise Almo, culture transformation leader.
We're with Cares by KJE. We are a tech-enabled strategy and leadership development firm specializing in diversity, equity, and inclusion. We are in the last part of our conversation with Leonor Marquez, CEO of LBU Clinic. Welcome back, Leonor.
Thank you. So happy to be here. It's been a lot of fun talking with the both of you.
Yes, it's been a lot of fun. Glad to have you.
Yes.
Thank you. Happy to be here.
Yes, so we are wrapping up our conversation around DEI, inequities in healthcare. So let's talk a little bit more about how LBU was formed, really out of the necessity of inclusion in an underserved community, which we talked a little bit about in part one. But how can other clinics embrace inclusion at a greater level to ensure everyone has an opportunity to live a healthy life?
That's a really good question, Devin. We've talked about how, being understood is really important if you're going to get the treatment you need, and you want to be able to communicate what your needs are, your conditions, in a place that gets you, that understands you, literally speaks your language, but also understands your background and what you're going through. So if we want to continue that, we being LBU Community Clinic, but we the medical community, we need to really keep, open our eyes and see what's out there. And the burden, quite frankly, so for so many years, it's been on the patient or the customer. You figure out how to understand us, not the other way around. I think that's shifting. I don't know a single doctor who doesn't want to make to help their patient understand their patient. I don't know a single healthcare team that is not really, really motivated by giving the best service they can. So the more we sort of enlighten our the healers, I think the better it will be. I mean, the more they want to learn. It has been my experience. It's like they learn a little bit and and I'm talking about all my staff. It's not just the physicians; it's the whole healthcare team. The more they learn, the more they want to learn. Because oh my goodness, I messed up. In their own head, they're like, oh gosh, I could have done that better. Or you replay the tapes from a couple of years ago, and it's like, okay, I could see how I missed the boat there. So I think the more training, the more insight we have, the more we want to have.
Yeah, that's good. And even when you talked about kind of reflecting back on the years before, it's really about kind of having that self-awareness to even take the time to think about, how did that experience go? How did I handle that situation? What could I have done better? So really being aware enough to think about that, but then open enough, I guess, to want to change and do better.
That's right. And I think we as an employer need to make it easy for our staff to do the right thing. Yeah. It's not just, okay, you better come to us fully trained and ready to go. No, of course. We want to talk to them about our mission and how we fulfill our mission. And it has to be mission driven, not rules and regulations. And this is, go to this training and get an A on the test and all. It really is, this is why we're doing it. This is kind of what happens when we miss the mark. So that it's not just judgmental and that kind of thing. It's very this is our attempts, our efforts to heal our community. And it's not just the medicines they take, is what is their belief system, what is their history, what is their what has been their experience with the medical community before, because that very much judges or informs their decisions today.
Yeah. How have you seen that kind of the historical, I guess, experiences that different populations have had with the medical community, research community from years and years ago? How are you kind of seeing that, I guess, long-term impact still today?
The impact is still there, and the form it takes is actually not going to the doctor.
Yeah.
And that's troublesome, because what happens is people will go without care and in some cases die in their homes. And I have had Native American people say, I would rather die in my home than see a non-Native doctor. In fact, that particular friend said, let me say that again, I would rather die in my home than see a non-Native. That is someone who has been injured by the system. That is someone who's had such negative experiences time and time and time again
Yes.
that it's not worth it. It's not worth putting themselves through that, themselves and their family. So it's very, very profound when we do it wrong.
Yes.
And so we want to be able to be, not to be perfect, because we're not going to, if we're striving for perfect, it's just not going to happen. But we want to get better. We want to understand.
Yeah, and I have so much respect for people that go into healthcare, in the healthcare industry, because I mean, I have a lot of friends that are nurses and doctors, and they don't necessarily just say, maybe some of it, but they don't say, oh, I'm going to go in this profession for the money.
Right.
Right. I mean, that's part of why everyone wants to build a career, but the majority of it is because they want to help. They want to help others. They want to help heal others. And I just feel like, especially the past 2 years with the pandemic, there's been such fatigue because they could have good intentions coming in of really wanting to care. But if you've got, just like any job, you got build up of a backlog of patients and charts that you have to do and such things, that you start to get desensitized with the care, right? Because you start being more transactional because you're just tired, right? You're fatigued.
That's right.
So all the more care for and understanding that there is fatigue out there recently, especially with the recent events, right? And still recovering from that. I don't think we've fully recovered yet.
No, and are we out of the woods yet with COVID?
Right.
I'm not really, and certainly not in the healthcare community. We're still very, very cautious, but not in a way that's off-putting, right?
Yes.
We're cautious, we're masked, we're distanced, but we're in our clinics very, very safe. But quite frankly, I think we went overboard, and so people stayed away. That's not good, and people of all stripes stayed away. And so childhood immunizations have really, really suffered. The immunization rates have gotten worse. And so if people stay away and don't get their shots, and the shots are not the kind of thing that you can send in the mail. It's not a pill you take. It's, you still, the old-fashioned way, it's getting a shot in the arm or in the behind if you're a baby. But there are things that we, in a culturally appropriate way, an accepting way, safe way, that we need to treat our population. We've learned a lot over the last couple of years. The medical community has, we've started down this way, and things changed because the guidelines changed, and that's been very frustrating for the healthcare staff. That's part of the fatigue, and very frustrating for our patients. And you can see how some of that builds mistrust.
Yes.
And so we, again, as a healthcare community and at LBU, we have to just work really hard to regain that, to keep the trust or regain it when necessary.
Yeah. And putting myself in a patient's shoes, because I've recently had to do this myself, of having to look for a new provider, because insurance has changed and things like that. What advice would you give for patients like myself to ensure, like when they're seeking a new doctor or seeking a new clinic, that they're, one, ensuring the respect and care that they deserve, but meeting their health needs? What questions should we be asking when we're talking to new potential providers?
What's interesting is Annalise, is the burden again on the patient or is it on the healthcare provider? Provider meaning the group. But let's put some of it on the patient, because we are responsible for our decisions. So some of the questions, if you're a Spanish-speaking person, you're going to say, habla español? Do you speak Spanish here? That's a really important first question, and you generally know that in the first conversation over the phone. Things like, do you accept my insurance? What does it cost if I don't have insurance? That whole issue of cost is huge in this country. As you know, we talked about your experiences in Italy and my brother's experience in Italy. It's a very real issue here. How much does it cost? And do you accept this, for that $800 care, will this insurance card, pay for that? All of those are very real issues. Lots of questions that the patient could ask, but also kind of what's the vibe that they get when they walk through the clinic? What's the feeling they get when they're talking on the phone to that person? Those are all clues. Those are all very real snapshots of what the practice will be like. And so we all, just like when you're searching for your doctor, what's the vibe? Is it sort of a hassle? Do you get hung up? Do you get all of the phone kind of stuff? And then when they're in there, is it greeted with smiles? We're implementing a concierge type reception at at our clinics, and it's not concierge as in concierge medicine and you pay more and no, it's Annalise, it's so good to see you again, or Dr. Owens, it's so good to see you. Come on in. How's the baby? Oh my gosh, Dr. Batson, can't wait to meet you. She's been looking for, that kind of thing. How long does that take? But wow, in a matter of seconds, you're now feeling welcome. You're now feeling like you belong here. They were expecting you. We're trying to get away from handing people clipboards, right? Or what's your name? When is your appointment? Who you're going to see. We know all that, right? We set it up. But regardless of the cultural background you have, imagine that kind of welcoming. Calling them by their surname if that's what's appropriate for that culture. Introducing yourself, smile. We've done some training on how to smile through a mask.
Through your eyes.
Through your eyes, your posture, and all of that transcends many cultures. So the burden, I think, is on the practice, is on the community, but there are some things that patients can ask and do and kind of feel and assess.
I'm so glad, Lenore, you said something about the front reception, because that is actually what turned me off recently.
Really?
Because they were just so matter of fact, rude, like on to the next thing.
That's right.
When I came in, I still had to wait an hour, and that was my experience every time I visited. Is I had to wait an hour. I'm like, what's my appointment for? Right. Which ended up getting me to switch to another doctor.
Yeah. And that's so important. I mean, sometimes in practices, all is forgiven when you see the doctor. Well, why does it have to be like that? Why can't it be, oh my gosh, I can't believe she remembered the baby's name. Or I can't remember, all of those delightful. And then, the person who takes your vital signs, a medical assistant is, talking to you and oh, I have a baby too. And, just kind of working that into the conversation. I think all of that is just super important and welcoming.
Yes, absolutely.
That's such a good point. We recently started at a new dentist, and so when we walked in, it was a whole family affair. All four of us went at the same time. But when we walked in, they had the board on the countertop with our names on it. And so, the kids lit up. They're, our names are on here. So they were super excited. So just that that initial response, we hadn't even, seen a person at the front desk yet, but our names were there. Like they were waiting for us to arrive. They knew we were coming, and we're kind of ready for that. So. I definitely think, implementing those niceties, that concierge service really makes a difference. It makes people want to come back, right, for more.
Because who likes going back to the dentist? I feel the same way about my dentist now. I was like, I'm actually looking forward to this dentist appointment.
And you know what they tell people? Okay, they're going to tell people if they had a bad experience, but they tell people if they have a good experience. They remember, oh, she's so sweet. They love the baby there. You're going to tell your comadre. You're going to tell your neighbor.
Yeah.
Oh, absolutely. Yes, and they're going to tell if it's a bad experience. More likely.
They'll tell more people if it's a bad experience.
Twice as more people.
That's right.
That's
That's right.
Yes.
That's right.
All right. Well, this has been a wonderful conversation.
Yes.
We
enjoyed it.
Really enjoyed having you on the podcast, Lenore.
Thank you.
Thanks for joining us, and thanks for sharing such great insights around what we can do as patients to ensure that we are seeking out healthcare providers that are culturally relevant and understand us, but also what healthcare professionals can do to make a difference and continue to make a change.
Okay.
Yes,
Well,
and we applaud you in the space that you're in, and serving our communities, and what you're trying to do has a domino effect in the community. So thanks to you and your staff for what you do.
And my thanks to you guys. I think we're a little stronger and more capable since we met you guys. So thank you, Annalise and Devin. It's been a pleasure talking to you.
Absolutely.
Thank you for having me.
Thank you. And thank you for tuning in and listening to 24 Cares, where we help you live a 24/7 commitment to DEI 365 days of the year.